And I now move us on to our last speaker in the abstract session in the theme of artificial intelligence and robotics. I would like to introduce Roberto Vagnetti from Nottingham Trent University in the United Kingdom. Thank you, Roberto.
Hello, and today during this presentation we will talk about a critical review of socially assistive robots in autism spectrum disorder screening and diagnosis, sharing some intriguing preliminary results. All of the authors declare no conflict of interest. Autism spectrum disorder is a lifelong neurodevelopmental disorder characterized by distinct features. These include deficits in social communication and interaction, such as impairments in social emotional reciprocity, nonverbal communication, and developing and maintaining relationships. Additionally, these individuals exhibit restricted and repetitive behaviors, which comprehend repetitive movements, insistence on sameness, highly restricted interest, and heightened or diminished reaction to sensory input. These symptoms typically manifest in the early stages of development, emphasizing the importance of early diagnosis and intervention. In recent years, technologies designed for individuals with autism have gathered significant attention. Notably, socially assistive robots have emerged as a focal point in intervention practices. Indeed, robots offer several advantages, including their predictability, which appears particularly well suited for this population, as highlighted by the researchers in literature. And socially assistive robots have shown the capacity to arouse strong interest and provide entertainment, as noted in other studies as well. While the utilization of socially assistive robots in the diagnosis of individuals with autism remains relatively limited, the primary aim of our current study is to offer an up-to-date comprehensive perspective on the various ways socially assistive robots have been utilized to facilitate the diagnosis of individuals with autism spectrum disorder. To do so, we conducted a systematic review following the PRISMA guidelines. Our search encompassed multiple databases, including Scopus, Web of Science, ScienceDirect, IEEE Explore, and PubMed. We employed a strategic set of keywords, specifically autism and robot, to ensure the relevance of the retrieved studies. Our inclusion criteria encompassed peer-reviewed articles with a primary focus on the use of socially assistive robots in supporting clinicians during autism diagnosis. Our research yielded a total of 7 studies meeting these criteria. During our analysis of the retrieved studies, we focused on several key aspects. Regarding the setting, we examined how the interaction with the socially assistive robots was structured in each study. We also noted the sample characteristics and demographics. We investigated the various performance metrics and behavioral markers that were employed in assessing the risk of autism during the interaction with the robot. And our analysis also consider the accuracy level achieved in recognizing the risk of autism. In Javed et al., participants engaged in interaction with 2 robots within a sensing station for 10 minutes. The study involved 18 participants, comprising 5 individuals diagnosed with autism and 13 typical developing participants, aged between 4 to 12 years. The risk of autism spectrum disorder was assessed based on the analysis of facial expression and movement patterns during interactions with the robots. The study reported an accuracy of 68% recognized the risk of autism using these measures. In Moga, Das et al., participants engaged in communication interactions with a robot for 190 seconds. The study included 16 participants with 8 individuals diagnosed with autism and 8 typically developing participants. Age ranges were 2.1 to 4.1 years for the autism group and 2.11 to 7.6 for the TD group. Risk of autism was assessed based on the spatial position of participants, and the study reported an accuracy of 81.3%. The study of De Cordy et al. Involved both individual and group interactions with the socially assistive robot. A total of 52 participants were included, with 36 individuals diagnosed with autism and 16 typically developing participants. Participants' ages ranged from 2 to 11 years. Risk of autism was evaluated based on expert observation of children's video recordings, following the criteria outlined in the DSM-4-TR. The study reported an impressive accuracy rate of 90%. The study of Ali et al. Focused on joint attention and imitation tasks involving 2 socially assistive robots. The study centered on 12 participants diagnosed with autism, with a focus on recognize those with minimal and mild autism severity. Autism risk assessment was based on participants' performance in the 2 tasks, and the study reported an accuracy rate of 76%. In the study of Kumazaki et al., socially assistive robots perform a simulated birthday party scene. The study included 34 participants, 15 with a diagnosis of autism and 19 typically developing participants. Ages ranged from 5 to 6 years. Risk of autism was assessed through expert clinician observation of the task, with a score based on a social communication score guide. The study only reported the area under the curve values. The study of Ramirez-Duque et al. Involved a joint attention task that lasted for 5 minutes. A total of 45 participants were included in the study, consisting of 29 individuals with autism and 16 children with other conditions. Risk of autism was assessed based on joint attention performance and the quantity of joint attention behavior exhibited. The study did not provide accuracy percentages, but noted that 17 out of 23 children in the autism group exhibited a different behavioral pattern. In conclusion, these results indicate that the risk for autism spectrum disorder was assessed through a variety of measures. Individual interaction with the socially assistive robots were typically of short duration. The setting and measures considered in the assessment varied significantly among the studies, reflecting a heterogeneous approach. The accuracy of the assessments ranged from 68 to 90%, where the highest accuracy was achieved when experts evaluated the individuals. And notably, no validation of a socially assistive robot mediated assessment was found. Here's the references. Thanks for your attention, and feel free to contact me via email. Bye.
Thank you very much, Roberto, for your excellent presentation. And ladies and gentlemen, thank you to all our abstract presenters. And that closes our first abstract session.